So we're very excited to offer a couple of innovations that really are not found anywhere for several hundred miles. So one could imagine radiation, as I mentioned before, is like a giant flashlight. And it's our job to make sure that people get radiation, have that flashlight pointed, and illuminate only the parts that we want to treat. So wherever that flashlight goes, it hurts tissue. If it's cancer in the middle of the flashlight, the cancer cells are killed. If there's normal tissue in the middle, then we damage those normal tissues. So we have several advances that allow us to localize the prostate cancer better than anybody in the region. The first is we have a imaging machine called the ExactTrack, and what that does is that allows us to track the prostate during radiation treatment. So it's kind of like having a homing beacon on the prostate cancer itself. We're able to track that. But then we then have a second system called Calypso, where actually an implantable radio frequency emitter or it's another beacon that's actually put inside the prostate, and then we're able to track that 60 times per second. So at our downtown radiation center, we have the ExactTrack system. At our the former suburban campus, now Women's and Children's campus, we have the Calypso system. So we are 100% certain at all time, no matter how patients are treated, that we're hitting the prostate. This means that we don't have to employ some of the other archaic methods of immobilization, such as a rectal balloon that is found in the region. So we're able to treat patients with more accuracy, and what that leads to is less side effects and higher cure rates. We're now going to be partnering with the RTOG in a clinical trial because standard of care for men with prostate cancer is 44 treatments once a day, Monday through Friday. It's a very effective treatment regimen, but that's literally 2 months and 4 days of treatment. So if there's a way that we can reduce that safely, we want to do that. So we're actually going to be participating in a series of clinical trials where men will be able to be treated in 5 treatments. So you can imagine the convenience factor of 5 versus 44. I think that we're all cautiously optimistic that we'll be able to still have cure rates of over 90% for low-risk prostate cancer, but also do it in a way where people don't literally have to put their life on hold for 2.5 months.